We're going to talk a little bit about AI in imaging of the spine. Some of this will be redundant with things you've heard before, but focused on the spine, and some of it will be novel and things you haven't heard beforehand. Just by the way, you can see this is just an example of two vertebral bodies and an intervening disc here in this particular example. So we'll start off with what is AI, and we've done this several times beforehand. AI is essentially a technology that lets machines do things like recognize images, that are associated with human intelligence rather than machine intelligence. We know these technologies around us everywhere, no matter where we go, and we know that it's a very big deal in healthcare with lots of spending by the big OEMs in the greatest amount and the greatest number of patents being filed. So this is a technology that is becoming more and more pervasive every day in the imaging enterprise. And the minute you print a slide like this, it's completely out of date. There's a lot of players in this space. Now, we've talked about a lot of things over the course of the first few days, both myself as well as some of the other speakers, how we can use AI throughout the imaging enterprise, everything from scheduling appropriateness through no-show analysis, to segmentation, which we'll talk about today, to dose reduction, and automated acquisition, which we'll talk about today. And we'll even talk about diagnostic assistance, triage type things all today. And earlier this week, we talked about things like synoptic reporting and results communication. So for the next 35 minutes or so, let's take some time to evaluate the impact of these technologies on imaging of the spine. We'll talk about automated scan acquisition. We alluded to this the other day. We'll expand on this. We'll talk about image reconstruction. I removed the CT image reconstruction from this talk because we covered it so well during the other talk, but we will focus on the MR image reconstruction so you can get a feel for some of the research and for the appearance of the images in the spine. We'll talk about CAD-T, or urgent finding triage. You heard Dr. Pinker talk about this a lot in the breast, but probably the area that's gotten the most traction thus far is in the brain and spine. And we'll talk about segmentation here. We talked earlier how segmentation helps pick up MS lesions and look for volume loss of certain brain structures. But today we'll talk about how it helps us evaluate the vertebral column as well as the discs. And then we'll talk about how there are commercial products right now which can actually assist in your reading of your lumbar spine, interpret the examination, and pre-populate a report for your vetting and the value that might bring